So calcium channel blockers are pretty important. Calcium channel blockers weren't on my NCLEX, but I remember friends saying that they had it on theirs. So, you know, I can't ever know exactly what's going to be on your NCLEX, but this seems to be an NCLEX favorite. So it can slow the automaticity of the SA node. And it can also do the same thing to the AV node. Okay, so it also decreases contractility. It decreases the contractility of the heart's myocardium. The muscle of the heart doesn't beat as hard, right? So it brings down that blood pressure, okay? So ultimately what happens is a lot of what it does to the heart looks a lot like what the beta blockers do to the heart. So it decreases blood pressure and can decrease heart rate. But it just does it in a different way by blocking the calcium channels. Okay. So it can also, there we go. They can also cause a prolonged PR interval. Okay, now all these things combined here, these are basically going to do this. Okay, so you're going to get that decreased blood pressure and decreased heart rate. It's often used as an antidysrhythmic, right? But calcium channel blockers can be used for a lot of other things too. So here we go. Calcium channel blockers can be a lot less dangerous than amiodarone, and they can have a lot less permanent damage than amiodarone. Amiodarone's got a lot of permanent damage type things. Things you're going to see with the calcium channel blockers, could see hypotension and bradycardia, right? We could overdo our intent, right? Kind of like overstaying our welcome. When you're giving any of these IV, just like with the beta blockers, giving them IV, you're going to want to put people on the monitor, okay? So these can also contribute to heart failure, unfortunately. So if people get edema after starting these in the feet or legs, so that is systemic edema, right? That might be a sign of heart failure. Okay. And then because of the vasodilation that this does cause, there is some vasodilation. People can get lightheaded, dizzy. Okay, so lightheaded and dizziness. I also want to put vasodilation here so that you're very keenly aware of that. Okay, in any IV forms, you want to monitor you want to have the monitor on the patient. And then they should report any of that dizziness or lightheadedness to the provider. And for this hypotension and bradycardia, that might be part of the lightheadedness and dizziness, right? Also with hypotension and bradycardia, have them rise slowly. This does have a vasodilation component. Rising slowly is always a good idea. And since it can cause both the hypotension and bradycardia, it's always a good idea. Now, sick sinus syndrome and heart block are contraindications. So especially heart block, and let's talk about this. Heart block is a contraindication because this slows the automaticity of the SA and AV nodes, okay? It decreases contractility, right? But this slowing of the automaticity of the SA and AV nodes, that is like, heart block is the slowing of these kind of on, you know, absolutely magnified. And so that's why it's dangerous to give to them. Now, some of the interactions with this that are kind of famous, they kind of end up on NCLEX type things because you need to know about them. Don't take calcium channel blockers. And I'm going to reword this. Don't drink grapefruit juice or eat grapefruits while on calcium channel blockers. So sometimes these interfere with meds because of absorption, blah, blah, blah. That's not how it's working with this. The grapefruit juice is actually causing an increase in the blood levels of the actual calcium channel blocker itself. So we tell people to stay away from grapefruit juice. Lithium and cyclosporin can be increased by this. Now, the big thing, another big key takeaway, beta blockers, if taken in conjunction with this, increase the risk of heart block and of bradycardia. And one more. And heart failure. And most nursing drug books still put these two types of meds in a precaution category. So you'd be very, very wary of that. Okay? So that's all the important stuff on calcium channel blockers.